Hey everybody, it is Alexandra with Optimum Joy, and I am super excited to have Dr. Alana Roth because, first of all, she's a wonderful clinician, but she's also a friend of mine. And before I get into all of her credentials, I know Dr. Alana from when I was like a baby trainee therapist. She actually trained not master's level students like myself, but doctoral students in, we worked in the same kind of agency together, and then like a few other things. So, but she predominantly specializes in working with children and adolescents, and she's worked with children in a clinical setting for more than 13 years, where she also does psychological assessment as well as therapy. So she has like a ton of experience, and a few years ago started her own clinic, Monarch Clinic, and yeah, there she besides doing all these things that I've mentioned, she also just supervises all her child clinicians there in the practice and outside the practice, as well as teaching doctoral students. So, Dr. Roth, you're amazing. You have amazing experience. And tell me, kind of define for me what we're talking about as it relates to children and adolescents today, and kind of why it's an important thing to be talking about.
Yeah. So, when I was thinking through what to talk about, I had so many different ideas and I was like, oh, I want to talk about this and this. There's so many different hot topics right now, if you will, and partly because of COVID. And families are stressed, right? And kids are stressed and kids feel that. And so, um, of all of the different topics to talk about that have been really salient and relevant for the last year, the one that really stood out to me in terms of what I've seen in the clinic, what I see when I see at home with my own kids, is attunement and regulation and dysregulation. And that is an area that I think I wanted to focus on because there's so much that parents can do to really help their kids, so much therapists can do, parents can do, to teach kiddos how to regulate and how to do that well. I am excited. I work with a lot of families and parents, and one of the things that I get really excited about is teaching them and learning together really what we can do as parents to support our kids into, if we think about the neuroscience behind it, how to really create new wiring in the brain and new pathways in the brain to help kids learn these skills.
Yeah.
So it's a skill piece, right? But it's also we're doing brain work. We're teaching kids how to we're rewiring our kids' brains. And so I've seen so much success in my own family and my own kids, in doing a lot of this work, a lot of the stuff that I'm doing. I have had to learn myself as a parent. It really changed everything for me when I became a parent. I was like, oh, I have to work on my own stuff. I'll talk about that in
Yeah.
a little bit.
Yeah.
It's going to be a pretty vulnerable interview, a very transparent interview, because a lot of the stuff I'm talking about directly applies to me and the stuff I've had to learn in my own parenting. So because there's so much hope when we talk about this, I've seen so much success and so much change. I think that's why I wanted to focus on this topic today.
Yeah. No, that makes so much sense to me, Dr. Roth. And, you know, I think that hearing how you actually apply what you do in like a therapeutic relationship to your own family only makes me feel more confident that it's like, this is the thing. Like, of course, you're Dr. Roth, and you have all these credentials, but it's like, no, this is actually what I use in my own home.
Yes.
And,
Yes.
when I used to see kids and worked at like a registered play therapy clinic, I think that all that I learned there about dysregulation in kids and helping parents and stuff like that actually made my work with adults so much more.
Mm,
It had like a lot more depth and richness, and I feel like some of those same things we forget that applies to like an adult brain, which is not what we're talking about here
yes.
today.
Yes.
But it's really really important, all of it. So
100%. Yes. That was one of the things I was thinking through yesterday when I was kind of preparing for what to talk about today, is when we talk about attunement, right? Which
mhm,
we'll talk about more later. When we talk about attunement, we need attunement in all of our relationships. When I'm attuned to my partner, um, if we are off, and then I stop and I think, well, let me stop focusing on the behaviors and let me attune to him a little bit more, then I can interpret the behaviors differently, right? I'm so much
yeah,
more patient. I really understand. In all of our friendships, family relationships, when I actually stop check myself and put my defenses down and can get into a place of vulnerability and openness and like, let me actually attune to you. It really does change our relationships. So yes, with children, with our
all of it.
partners, yeah, with all of our relationships, this really is a game changer, I think.
And so before we kind of get into attunement, I kind of have heard over and over and over again that what is hard for parents sometimes is really kind of when a parent calls in for counseling or therapy, it's because a child is defiant or acting out or angry or hitting their siblings or, kind of getting into that rut of they can't figure out, they've tried everything, they can't figure out exactly what to do with like defiant behaviors. And I love that you said earlier, there's the behavior and then there's like what is going on alongside that. But what do you think like some of the contributing factors or what kind of contributes to a child being defiant?
Yes, yes. I think if we think about behaviors, if we can think about it in with the lens of behaviors are communication, right? So we are able to communicate via words. So I can express myself to you. We can do this effectively. If there is something I need, even as adults, we struggle with this actually, but there's whole treatments, evidence-based treatments on effectively communicating our needs, because that is how bad we are at that as adults. So think about decades before all of the skills that we have, all the language skills, all the social skills that we have, decades before this, when my 3-year-old or 5-year-old struggles to he has a need, he doesn't know how to communicate that, right? And so kids are communicating through their behaviors. And so when I can stop and think, what are you asking for? What are you really needing from me right now? What are you needing in general right now? If I can think about behaviors as a communication tool, a language, I was thinking this last night, it is their language. The behaviors is their language. They don't have we tell kids all the time, use your words. They don't have the words, we have to teach them those words. And before that, we as parents and as caregivers and as therapists, as adults in kids' life, teachers, my son's teacher is such a gem because she is able to do this so well. I see her doing this all the time. And she's able to really look beyond the behaviors and look at what do you need right now? So if we can stop and kind of have a paradigm change, instead of just focusing on the behaviors, which is what a lot of parenting recommendations, even therapy recommendations decades ago were recommending, focus on the behaviors, punish those behaviors, reward these behaviors, and punish these behaviors, right? So the reward and consequences. That was really the focus of therapy and of treatment and of managing these difficult behaviors, defiant behaviors decades ago. Now, what we know from current literature and current research tells us, there's even a book called Beyond Behaviors. Let's look beyond the behaviors and put on like a detective hat to see, what do you need right now? What are you trying to communicate to me? What do you need? And I think when we can do that, we can go so much further with our kids, and we can actually when we are able to actually meet their needs. What we see is an 80%, what we see in research shows an 80% drop in defiant behaviors.
Wow.
Just by attuning, by connecting, by meeting our kids' needs. And so the key to that really, I have found to be attunement. If I can go ahead. I can keep talking.
Oh my gosh. Well, it's just really the whole picture of almost like the game of charades comes to mind. And I haven't ever thought about this before, but it's like we think about charades as not really using words. You're using actions to try to communicate something. And I almost wish that maybe parents would think about it as charades, especially because I might have the years a little bit off on this, but it's not really around like 10, 11, 12 that like words take on a different meaning in the brain. It's like when a word actually like comes to life in a way, like obviously your kid can speak before then, but it doesn't actually land as like, this means something to me until a little bit later on. So kids are so much more in their right brain. They're in their like an image, a feeling, a picture,
Yeah.
a color, a,
Yes.
just these different things. So I think a big takeaway is almost like, man, if maybe parents should start to conceptualize their interactions with their children almost like charades.
Yeah, I love that. I have never heard that or thought that, but it totally fits. I think you're totally right. If we can just sit and watch them. And when I think about my own day-to-day functioning, right? I'm a working mom, I have a busy life. And so when I am preoccupied mentally with all the things
Mhm.
that I'm thinking about, that I have to do, which is often, right? That happens quite a bit. And then my son is sitting here needing me. I so often am thinking about the thing that is on my mind that has to do with anything besides him. And then he's communicating to me, I need you, just sit with me, just be with me.
Mhm.
Mom, what is this? What is this? And I'm like, oh, there's another thing.
Yeah.
When I am at that point that I am not attuning to him and sitting with him because I'm just in my own thoughts, then my response looks so versus times that, and this has been absolutely a learned behavior. I've had to really work on this in my own therapy, in my own work, learning how to put my own stuff on the side. I've changed my schedule so many times so that I could do this well as a parent, so that when I'm home with my boys, I can actually be with my boys.
Sure.
And that looks different for every parent. So I put my phone on silent. I put it in the room sometimes so that I am not tempted to respond to a text or respond to an email, respond to a work need. And sometimes even at this point, I'm like, to my husband, sorry, babe, we're having pasta for dinner, right? I didn't spend my afternoon focusing on dinner because I was sitting and playing with the boys. We went outside or we were playing Legos downstairs.
Yeah.
When I can actually be with them and give and attune to them and attune to their needs, then I am able to track with them. I'm able to see what they're actually needing. I can interpret their behavior differently
Yeah.
than when I'm not sitting and being attuned to them. And what we have found in research, this is fascinating. What we found in research, there are evidence-based treatments that recommend once you learn to do that well, and you can follow your child's lead, be attuned, even 5 minutes a day continues the decreased defiant behavior. So when I can sit with my
Mhm.
kid, even they say 5 minutes a day, then what we see is
Yeah.
those defiant behaviors, the attention-seeking behaviors, those continue to be decreased if I'm doing that well on a regular basis. It's hard to do.
Mm.
Even 5 minutes a day is hard to do. But when I think about how much time it takes to redirect or manage the difficult behaviors, 5 minutes a day pales in comparison to how much
Yeah.
time it takes to manage an attention-seeking, some attention-seeking behaviors.
Yeah. Well, really, what you're describing, Dr. Roth, is the probably one of the hardest problems of modern day parenting.
Mhm.
Because when there's so many things competing for our attention, or even like you said, being a working mom is in and of itself um, a complication to parenting. And if there's all these things really vying for our attention, um, it can be real. I can imagine it could be really easy to kind of not tune into what kids need unless like they're something's like hurt or they're like really hungry or they actually can say I need water, and
Yeah.
that it may just be a little bit different to kind of like refocus our attention in that way.
Mhm, mhm.
Mhm.
Yeah, yeah, absolutely. And when I think about the clients that I have worked with and the parents that I've worked with, working or not, I think parents have a lot of demands on their time. And so, um, actually, I know that parents have
Yeah.
a lot of demands on their time, and there's always things to fill it with, right? And so, it does take quite a bit of discipline and intentionality as a parent to say, I am going to sit with you. I'm going to be attuned to you. I'm going to be paying attention to you in
Mhm.
a different way um, than feels natural or then feels natural because there's so many things competing for our time. When I am working with parents and we really start exploring this a little bit more and how to do this and what this looks like, and like I said, I've had to do that in my own work, in my own therapy of what are the things that kind of pull for my attention. Where can I put those in my life? You and I were just talking about that earlier. Where can I put these things in my life so that when I'm with my boys, I'm with my boys?
Yeah.
And that's not realistic to do that all the time, but but to prioritize that above other things really has been a game changer in my own life and in a lot of the families that I've worked with. But that takes a couple things. It takes being a detective instead of focusing on behaviors, being a detective and thinking, what do you need right now? What is your attention communicating to me? What need is not being met? What skill do you not have that that I can help teach you so that when you're needing this, you can communicate that differently and more effectively. And also, what can I catch in the moment so that I'm not playing catch up later on, if that makes sense. So for example, if my kiddo needs something, attention, or even his brother's bothering him, happens quite a bit in my house. I have a couple of young boys. And so, one brother's kind of bugging the other, and then the younger brother, maybe my older kiddo is bugging my younger kiddo, and then my younger kiddo, throws something or hits or says a word he's not supposed to say. And what do? If I'm not paying attention, I react to the younger kiddo who said the word stupid, who called his brother stupid. We don't say that word in this house. What can we say instead? Blah, blah, blah. But what happened before that? And it actually took, my husband's not a clinician at all, but it took him saying, but what happened? Like recently he said, but what happened? What did you do? What happened right before that? And I was like, like, this is what I do. And in my day to day, I missed that. I was focusing on the behavior that is not allowed in my house versus what precipitated that. What was the trigger for that behavior? And so if I take time to actually notice what's happening, I can be more in tune with how to support him, what need, what skill he actually needs, and what need is not being met, and then kind of partner with them in that and how to problem solve together.
Right. It's really seeing things in like the story of it all. There's it's one thing to kind of take a snapshot or like a page of a story. And it's another thing to think about, like, how did you get here and what all happened? Kind of the arc of a story. Yeah, I really love that. What really would be some, probably as parents are listening in on this, or even like teachers, or those who are in like childcare and nannying and stuff like that, what's really are there any like resources or things you think would be helpful to people, just as they're kind of diving more into this? And obviously one of the kind of ways people can seek out help is to seek out like a therapist and to go to counseling. And there's a lot of resources that sometimes people can try, even like you said, 5 minutes a day of attunement shows like an 80% decrease in defiant behavior. I don't know if you connected those two things earlier, but I just connected them. So are there any like recommendations that would be helpful to people?
Yeah. So I have a couple go-tos here that I really love, a couple resources that I really love. Bear with me as I'm pulling them up here. So one of them is the book I mentioned earlier, Beyond Behaviors, and that's written by Mona Delahooke. She's a child psychologist out in Southern California, and she's fascinating. I think she's fascinating to me because of a couple reasons. She actually wants to get rid of the diagnosis of oppositional defiant disorder. It's quite controversial because it's a DSM diagnosis, right? It's respected by American Psychiatric Association, and when I do testing with kids and there's difficult behaviors, oftentimes if a kid meets that diagnosis, I've kind of gone back and forth with other fellow clinicians, colleagues about this, that if a kid meets that diagnosis, why didn't you give them the diagnosis? And I kind of say, I don't care if they meet that criteria. I don't care if they meet criteria for oppositional defiant disorder, because I care about what's underneath those behaviors. What are the things that are driving those behaviors? Is it anxiety? Is it depression? Is it family difficulty? Oftentimes it's anxiety and depression. Oftentimes there's a mood component to it that is driving those behaviors, or a skill deficit, or my goodness, there's so many different things, but school related difficulties, right? Which then includes stress. So, and it's manifested in defiant behaviors, but I don't want to slap a label of ODD on a kiddo, because I want to get at the root of what's going on and not just focus on the behaviors. And so, I agree with a lot of Mona Delahooke and what she says. Her book Beyond Behaviors is fascinating, and I would recommend that one for a lot of folks. There's another book. This one's written for parents. It incorporates a lot of Ross Greene's book. He focuses on behaviors as well, and how to look beyond that. He doesn't focus on behaviors. He writes books written for parents, and also kind of understanding how to manage the difficult behaviors. So this book called Overcoming Oppositional Behavior is by Dr. Gina Atencio-MacLean. She's also in Southern California, a little bit more south. And she wrote a book that incorporates a lot of Ross Greene's work with a lot of Dan Siegel and Tina Bryson's material in that. But it's a book, it's kind of a curriculum for parents. So it's a parent resource. There's 2 parts of it. And it is a compassionate, beautiful, just so respectful for parents. A lot of literature really focuses on here's what parents have to do differently. And this one's like, this one focused so much on like, this is really hard and take care of yourself. So, and probably every chapter is talking about what are you doing to take care of yourself? How are you taking care of yourself today? And so I really appreciate that perspective, but it also incorporates a lot of the evidence-based research on what really helps reduce defiant behavior. So I love that book. That's one that I would recommend as well, Overcoming Oppositional Behavior. And then my favorite, I can talk about them all day, Dan Siegel and Tina Payne Bryson. They have written several books, Whole Brain Child, No Drama Discipline. One of my favorites The Yes Brain is another one. One of my favorites, and a lot of what I'm talking about really comes from this, is their second to newest book, which is called The Power of Showing Up. Whew, this one rocked me because this book was really about what we need is what we know is that we have to attune to our kids. But my goodness, sometimes that's really hard to do, right? What makes it hard? And I work with parents all the time who I'm teaching them these things. I'm saying, this is what we need to do. And they're like, yeah, I can't do it. Like, or I try to do that. And then what happens is when we're in a state of vulnerability with our kids, our own stuff comes up. It happened just this morning with me and my 6-year-old. This morning, he kind of gave me attitude and I reacted. I took offense to it. I mean, I was defensive, like, wow, he's 6. But my own stuff came up in that moment. And that is what happens with parents. We're people, we're human, right? And so when we're attuned to our kids, that really does require vulnerability and openness. And hey, like, what is going on? What do I need to look at to help you and support you? What's making it hard for me to sit with you in your needs and your feelings? And my kids have only had several years of life to live. And we've had many, many more. And so they have a lot less skills than we do, but we expect a lot from them. So attuning to them without defenses, without excuses, without inhibition, and really allowing ourselves to attune to our kids requires quite a bit of vulnerability. And so this book, The Power of Showing Up, really talks about when your own stuff gets in the way, what do you do with that? How do you manage that? And what they say, I love this part of it, because what they say is you don't have to have a perfect past or a perfect attachment history in order to do this well. You have to understand it. We have to understand, the things that have made it hard for us growing up. We have to understand our own history and make sense of it. But we don't have to have perfect, secure attachment relationships in our history in our family of origin, in our history, in order to do this well for our kids. What we have to do is I know, so much hope, right? What we have to do is work through our stuff, understand our own stuff. Again, here's another plug for our own therapy as parents and as caregivers, so that we can actually put ourselves to the side and make our kids feel safe, seen, soothed, which leads to a healthy and secure attachment. So those are the 4 S's that they really talk about: safe, seen, soothed, and secure attachment. And so that's possible for anyone, regardless of our history and our stuff. So that book, I think, has really, and again, like we talked about earlier, that has direct implications for our adult relationships, for all relationships in our life. When it's hard to be vulnerable, it's hard to be transparent. Maybe it's hard to attune to people in our lives. What is it about our stuff that's coming up that's making that hard? And let's do our own work so that we can do right by our kids and by the people in our lives.
Dr. Roth, there's so many things that I'm walking away with that I'm going to continue to think on. And I feel like you've given not only a a like conceptual framework for how do we, it's not behaviors, it's communication.
Yeah.
And how do we like meet the communication or the need is through attunement. Like you've kind of given us in general just a conceptual framework in really a relatively short amount of time, and a lot of really helpful guided directions for parents to pick up on that. But I think the thing that I've most appreciated is your like yourself as a parent, and also the compassion you've given to parents, whether they're working or not. It's just like a hard thing to be a parent.
Yeah.
So there's just so many things I'm walking away from this
Mm.
interview with, from you specifically. And so thank you for
Yeah.
like coming on and talking about just how people can be not good parents, but just like attuned parents,
Yes.
maybe is a better way to do that. And if anybody is like looking to find you, where's like the best places for them to find you, whether a website or a social media handle or
Yeah.
anything like that?
Yeah, so our website is monarchclinics.com, MONARCH clinics.com. And so my email's on there, Alana@monarchclinics.com. Feel free to reach out if you have any questions about this. I could talk about this all day long,
Yeah.
all day long. So thanks for having me on here. It really is a pleasure to be able to talk about this with someone else, another clinician who agrees with a lot of this stuff. So thanks for having me.
Oh, it's been wonderful. Thanks a lot.
Yeah, no problem.